Hi, Nicole. Thank you very much for the introduction. And I'm really happy to be here this morning to be kickstarting the National Eye Care Day Public Health Talks. As mentioned, today I'm going to be talking about childhood myopia and how our recent pandemic has affected the situation a little bit. So let me share my slides with you. Okay, all right, so as mentioned by Nicole, we are kind of talking about childhood myopia and how COVID has affected this. And hopefully I'm able to give you some tips for maintaining the eye health of our children, especially in such strange times. All right, so with regards to myopia, we're really hitting the headlines with regards to this topic. As you can see, myopia is something that we do talk about in public health a lot with regards to our children's health and, even in adult health as well. The reason is because myopia, it's a spectrum of diseases that is associated with long eyeball length, and this can result in certain diseases, as I will maybe explain a little bit in the next slide. So why the big deal about myopia? What is myopia? So myopia is just short-sightedness. And you yourself, or probably the people around you, it's not uncommon to see people wearing glasses for short-sightedness. We are known as the myopia capital of the world. We do have very, very high rates of myopia. This is very similar to other Asian capitals, although globally this incidence is really increasing. So the worry is, if we kind of extrapolate our data now, by 2050, 80 to 90% of Singaporean adults will be short-sighted, but more of concern, 50 to 25% may actually be highly short-sighted. And when we are highly short-sighted, what would the implications be with regards to our eye health? So we're kind of looking at risk factors for diseases, for certain eye diseases, when we have varying severity of myopia in this slide. So we have low, moderate, and high myopia. Let's look at cataracts. You can see that there is definitely an increase in risk factor for cataracts when you are increasing in myopia severity. This is definitely more pronounced in diseases such as retinal detachment as well as myopia maculopathy. So retinal detachment and myopia maculopathy are potentially sight-threatening diseases, and you can see that if we allow high myopia to occur, and if more people get high myopia, then we definitely can see more people getting visually affecting diseases, and this impacts on their quality of life, and of course it also causes a general health issue in the future as well. Okay, so specifically when we talk about myopia in childhood, myopia occurs when the eyeball continues to grow longer than usual, and this actually happens mainly in children in the age group of like the primary school age, so maybe around 7 to 12. Make no mistake, you can definitely get myopia earlier than that, and we do see patients for that, and we do monitor myopia all the way up to adulthood and old age as well. However, the critical period for intervention would be this age, the primary school age, and it could be primary prevention, meaning like in this talk, we are kind of talking about how we can maybe minimize the onset of myopia, bring it back further, and also if you've got myopia, what are some of the interventions you can do with regards to reducing progression? This can include medical intervention or device intervention such as spectacle lenses, special spectacle lenses, contact lenses, or atropine eye drops to reduce progression of myopia. So why we want to intervene during this age is that we want to reduce the then further risk of myopia-related diseases, as mentioned in the previous slides, in adulthood. The window of intervention is not in adulthood, but in childhood. So this is where we would put our emphasis on. So how could the recent pandemic have impacted our children's eye health? Well, let's look at some lifestyle changes. Pre-COVID, unrestricted outdoor time. We have normal schooling on a daily basis kind of situation. There's normal operation of activities. The playgrounds, the swimming pools, the water parks, they don't have any restrictions with regards to the numbers. Public education series are available, and we actually even go to the schools. We go into public places such as the library to kind of bring awareness of this disease and how it can impact your life. And we also importantly have normal scheduling of appointments. This would be with the eye doctor as well as any eye care professionals. So going to an optical shop, going to the community based healthcare clinics, coming to our eye center. Usually appointment-based wise, it's quite reasonable and quite accessible. But post-COVID, what do we have? So for the DORSCON Orange COVID period, we were stuck indoors. Most people were stuck indoors. We couldn't go outdoors. For the children, I think in particular, the mask issue may be a little bit more pronounced in terms of discomfort. They don't want to go outside because they have to wear the mask. And then, with the disruption of school during circuit breaker, we then had home-based learning, which then involved a lot of near work, including device work. And there's disruption of regular public health education, such as this one, although we have managed to modify our eye care day today, and I think that's a good step, a step in a good direction. And the other thing that is also quite important is that it has restricted appointment scheduling. So during the COVID, for example, some centers had to be, some non-essential eye care were suspended temporarily, and this has caused quite a bit of anxiety amongst patients and parents because they also know that with the recent changes, it is possible that short-sightedness, myopia in their children may be affected. So these are some of the changes that we see. And if we kind of look at it, studies have shown increased myopia progression in children in winter seasons overseas as compared to summer seasons where they are kind of out in the sun. So factors such as decreased illumination, more near work, less outdoor time, these were suggested as reasons for this seasonal difference. So in our study from our center, we also discussed how these same factors can be aggravated during and even beyond our COVID pandemic. So what are some tips that I hope to share with you, kind of going by what regular tips we have in terms of reducing myopia progression or even preventing onset, and how we can apply it to this time. So first, we try to commit to outdoor time. I would kind of put this as the first tip because this is has significant impact, and by guidelines, we kind of put more than 2 hours per day. I know that this is not the easiest thing, and parents, myself, we kind of have understanding that how are you going to take up 2 hours per day for this? I think the idea is that we kind of split it up. It doesn't have to be continuous. It could be that they had more outdoor time in school, and then subsequently at home, maybe you can try to involve 45 minutes to an hour of outdoor time. So what are some of the good tips that parents have shared with me, or that maybe I have discovered on my own? We kind of look for good timings with regards to kind of going outdoors. We go to less popular locations because obviously those huge playgrounds and all that sometimes will be quite crowded. And some parents would have preferred their children to be on face shields versus masks, just because if they're kind of outdoors, they're kind of exerting themselves, maybe that is a little bit more comfortable for their children as well. The next tip that we always talk about in myopia prevention is good reading posture. So kind of sitting up and about 30 cm away, more or less, not like where you are kind of like crumpled on the table, reading very closely reading closely and kind of doing their homework like with that face on the table, for example. So with regards to, the recent changes in how we have more HPL or even, Zoom-based activities, just ensuring that the home computer setup is ergonomic and making sure that if possible, and I know that this is difficult because different family members are using multiple devices at a time, that the children are able to use bigger screens, because then they can be seated further away, and it's less, they can actually focus less. That's what would be beneficial. So the third tip would be near work breaks, and this would be again important if you consider that sometimes we just can't eliminate that near work. Near work meaning, things that you put close to your eyes, about 30 cm. So reading, mobile phone use, device use, homework kind of situation. I would advise, if possible, where possible, to kind of have a break every 30 minutes or so. It doesn't have to be a very elaborate break. It can be just a simple water break or a toilet break kind of situation. Next tips, we have also a reminder for good illumination while doing near work. So actually you can see in the top picture, this is actually my own daughter. This is when she was doing home-based learning. And what I've done is that I have placed her next to the window, hoping for good natural illumination, ensuring that it's not kind of like a dark environment. I think some parents have also asked me, if the screen is illuminated, then does that mean I can be in a dark room? I would probably still suggest good surrounding illumination while doing near work, whether it be on a device or just like reading or like homework based or something like that. Okay, and then the other tip, of course, if we can reduce the amount of near work, that would be good. And I think the idea of that is just looking at what is required versus what's pleasurable. So in terms of required homework, again, some scheduled activities that's not possible to reduce. But with regards to maybe like pleasure, just like recreational reading or mobile games and all that, I think that's something that we can look at in terms of just moderating it. And with regards to scheduling of eye care or just kind of maintenance of eye care, you can also look for alternative care options. For example, we did also have a video consultation option available during CB as a pilot. And now actually going forward, we are in a Myopia Center actually offering this as an alternative care option. So this is our Myopia Center. This is where I work. In Myopia Center, we both see children, again, with the thought of giving eye care, kind of like looking at what your condition is, giving you some information on how to maintain good eye care, as well as if there is a need to do some treatment. Again, in myopia, there are certain treatments to reduce myopia progression. And over here in Myopia Center, we do quite a customized treatment for each child to see whether we can optimize their condition. So again, the take-home message, commit to outdoor time, good reading posture, near work breaks, good illumination, try to reduce near work in terms of absolute amount, and looking for alternative care options such as video consultation with your eye care professional. All right, I'm done with my talk. I hope to maybe look at some questions to see if we can have a bit of a discussion. Okay, I'll just stop share first. Okay. If there are any questions, you can just pop them into the chat and I'll see whether I can address them. So I do see one recent question from the participant. I think it's a good question. Some parents do think that if we can just hold on till the patient gets to 21, which is the usual age for the minimum age for LASIK or any refractive surgery, then we don't have to worry about myopia anymore. Well, in a way, the refractive surgery just reduces your dependence on visual aids like glasses or contact lens, and it enables you to see quite clearly as though you have no myopia without these aids. But the risk factors, like I mentioned before, with regards to diseases, because your eyeball is still long, they will maintain there for the rest of your life. So refractive surgery actually does not reduce your risk with regards to myopia-related diseases in adulthood. So that's important to note. As mentioned, I think someone was asking about eye drops, and that's what I also mentioned. In our Myopia Center, we do have atropine eye drops. Atropine eye drops are kind of eye drops that have been very efficacious in reducing myopia progression in children. With regards to whether you think that your child may be appropriate for this, I would say make an appointment with us at the Myopia Center. We will evaluate the situation and we can give you quite a few tips and give you some treatment options as well. Okay, I think some people are also asking about orthokeratology lens or OK lens. So as mentioned, with regards to intervention to decrease myopia progression, there are three large groups. One is special spectacle lenses. I think again, some people are also asking, with regards to spectacle lenses, are there any strong impact of blue light filters? I think what I tell parents is that the studies are actually very inconclusive at this moment with regards to myopia progression. So with regards to recommending for blue light filters, I think I would probably hold back on that because the studies are still quite inconclusive. The second bit would be contact lenses. And contact lenses, there is the day lens, like multifocal soft lenses, and there are overnight lenses that are rigid, and these are orthokeratology lenses. They do have a role in reducing myopia progression. They do have some efficacy in this area. However, again, like I mentioned, I would probably urge for you to bring your child to our center. We can have an evaluation and give you the options with regards to what may be ideal or what is recommended to see what we can help you with to reduce myopia progression. Okay. So someone is just asking if they can wear sunglasses. Children can wear sunglasses, no issues. But I think one of the things that maybe people are not aware is that most of the normal glasses that you wear, they do already have UV protection. So, you know, with regards to UV protection, if you are wearing glasses, there's actually that layer of protection there. Okay. I will not be able to address all the questions, but let me just look at maybe one last question and we can address that. Okay. So a few things. One is that some people do ask about when the degree usually stabilizes, and if they're on treatment, when would that be till? So usually just kind of going with the bell curve, most of the children that we see will kind of stabilize around 12, 13 years old. So that is also around the age where if we find them to be stable, we actually start reducing the treatment then as well. But again, this is, you know, kind of rule of thumb. We actually see each patient and assess their stability before we reduce their treatment. So we will really have to see on a case-to-case basis. If you do have myopia, I would suggest that you wear glasses. Again, depending on your child's age, how bad the vision is, how high the degree is and all that. There are a lot of considerations there with regards to whether the child needs full-time glasses use or whether they're okay with part-time. So again, if you're unsure, I would probably, you know, approach an eye care professional. So that's all time we have today. Thanks for participating in this webinar. And again, if there's any other questions, you could just email the questions to us. Thank you.